Okay, Erin. This morning, we have a busy clinic, but I want you to see a few people so that we can really talk about things. So one of my patients is in room 4. Her name is Ann Thompson, and what I'd like you to do is do her annual Well Woman exam. So basically get her history. You don't need to do the exam, and then once you're finished with that, if you'd come on out and present that to me.
Okay.
Okay.
Thank
All
you.
right, she's in room 4.
Okay. Hello, Mrs. Thompson?
Yes.
My name is Erin.
Hi, Erin.
Nice to meet you.
Nice to meet you, too.
I'm a medical student working with Dr. Stewart today. And if it's all right, I'd like to talk to you a little bit first, and then she'll be in to see you as well.
That'll be fine.
Great, thank you. What brings you in today?
I'm just here for my annual checkup.
Any concerns or things you'd like to talk about?
Yeah, I'm starting to wonder about my menstrual periods and whether or not what I'm experiencing is normal or not.
We can definitely talk about that. Can you tell me a little bit about what you've been experiencing recently?
My periods are just becoming less frequent and lighter.
Okay. How long has this been going on?
I've been noticing it and tracking it a little bit for about a year.
About a year now. Okay. And you said that they're less frequent. How frequently are you getting your periods?
Probably about 6 to 10 weeks apart.
Apart?
Right.
Okay. Do you have any additional concerns?
Yeah, I've been wondering lately if I might be at a higher risk for breast cancer.
And what is it that has you concerned about that?
My mother died of breast cancer.
Oh, I'm sorry about that.
Thank you.
How old was she when she died of breast cancer?
She was 67.
67. Okay.
Yeah.
Any other family members with a history of breast cancer?
No.
Well, it's definitely something that we'll look at today. We will do a breast exam as part of your exam. Do you know when your last mammogram was?
3 years ago.
3 years ago, okay. Well, you're due for a mammogram, and so we can talk about scheduling that with Dr. Stewart.
Okay.
Sorry about that. I
Oh, okay.
forgot to turn this off. Let me just see who it is real quick. It might be... no, okay. All right, I'm sorry.
Okay.
Have you ever been pregnant?
Yep.
How many times have you been pregnant?
Twice.
Are both of your children, or both of those pregnancies come to term?
Yes, my beautiful sons.
Okay. And how old are they now?
My oldest is 25 and my youngest is 22.
Great. And have you ever had any abortions?
No.
Okay. All right. And do you know when your last pap smear was?
It was 3 years ago.
3 years ago, at the same time as the mammogram?
Right.
Okay. And have you ever had any abnormal pap smears?
Yeah, I did. I had one.
Do you know how long ago that was?
I was in my mid-30s, so.
And have you ever had any sexually transmitted infections?
Does chlamydia count?
It does.
Yeah, I had that.
Okay. How long ago was that?
Oh, I was in college.
Are you currently sexually active?
Yes,
With men, women, or both?
with one man, my husband.
Okay. And it's a monogamous relationship?
It
as
is.
far as you're concerned? Okay. Do you use alcohol?
Rarely.
So less than once a month, do you think, rarely?
Probably once a month or so, sort of weddings, special occasions kind of thing. I'm not a big drinker.
Sure. Okay. Do you use tobacco at all?
I don't.
Okay. Any other recreational drugs?
No.
Okay. And do you use caffeine?
Yes.
How much caffeine do you think you have a day?
Oh, I probably have 2 cups in the morning before I go to work.
Do you have any allergies that you know of?
Not that I know of.
Okay. Have you ever had any surgeries before?
I did have my appendix out.
Okay. So how old were you when that happened?
20, early 20s, 21.
Are you currently taking any medications?
Yes.
What medications are you taking?
I take vitamins. I don't know if that counts as medication, but I do take them every day. And then I take, I just forget the name of it.
Nifedipine?
Nifedipine. I don't know why. I can never say that right.
It's a tough one.
Is it? Okay.
Anything else you take on a regular basis?
I started taking red clover, drinking tea, and black cohosh.
Are those herbal supplements?
Yeah, I see an herbalist.
An herbalist?
Well, she's a trained herbalist. She has a clinic on the east side.
And these kind of interact with other medications that you take, so they can be kind of dangerous.
Gosh. She seems to think that her other female patients do well with them.
Well, that's something we can talk about with Dr. Stewart. Herbal supplements like that, we aren't well studied. What I'd like to do now is I'm going to step out of the room and talk to Dr. Stewart about what we've talked about. And when Dr. Stewart and I come back in, we will examine you, heart and lungs, do a breast exam as well as a pelvic exam.
Okay.
Okay. Any questions for me before I go?
No, I don't think so.
All right, great. Thank you.
Thank you.
Okay, Erin, now wait, you saw one of my patients and we're going to present, and who was it that you saw?
I saw Ann Thompson.
Ann Thompson, okay, so a well woman exam, basically just took the history, we need to go see her. But if you could just tell me a little bit about her so that I, have the story before we go in.
Sure. Ann Thompson is a 52-year-old G2P2 who presents today for her well woman exam. She does have a few concerns today. Her menstrual periods have been changing over the past year or so. She's having less frequent and irregular periods. She gets a period about every 6 to 10 weeks. Her periods last 3 days now, where they used to last 5 days. She's also noticing less flow. She has had some associated symptoms with this, where she's having some difficulty sleeping at night and some sweating at night as well. She's tried taking black cohosh and red clover teas that were prescribed to her by an herbalist. I told her that probably wasn't a good idea.
Well, why don't we see her, why don't we talk to her, and then you and I can talk a little bit about herbals.
Okay. Her other concern today is that she would like to be screened for breast cancer. Her mother passed away at age 67, and so she is concerned about that. Her last screening mammogram was 3 years ago.
And any pertinent negatives?
I don't think so.
Okay.
Yeah.
Okay, all right. I don't have any other questions. Do you have any other questions for me before we go in and do her physical?
No, I don't think so.
Okay, let's go see her.
Okay.
All right, Melissa, do you want to tell me about Miss Potter before we go see her?
So this morning I saw Mrs. Potter. She's a 40-year-old G4P2022 who's post-op day 3, status post-repeat low transverse cesarean section and bilateral tubal ligation. This morning she's doing well. We're controlling her pain with oral ibuprofen and oxycodone. She is having some nausea. We've been controlling that with oral Zofran. She's breastfeeding and she feels like her milk is starting to come in. She's been working with lactation because she's been feeling a little bit engorged, but that's been improving. She's been up to go to the bathroom and she's not yet had a bowel movement, but she is passing flatus. Otherwise she's been able to eat and drink okay. So this morning her exam is, everything is normal. Her incision still looks good. It's clean, dry, and intact, and the staples are still in place. So for her plan, she's Rh positive, rubella immune. She had the tubal for birth control. She's breastfeeding, and she wanted to stay 1 extra day to recuperate, so we anticipate her going home tomorrow.
Okay, that's good. All right, well, let's go see her, see how she's doing.